What is up, guys? Happy New Year. And since it's New Year's Eve, I want to talk about a very fun disease called holiday heart syndrome. Holiday heart syndrome is the phenomenon where patients come in with heart arrhythmias following periods of binge drinking. And given that 25% of alcohol sales happen in the 1 month period between Thanksgiving and New Year's Day, it's not hard to imagine why this happens typically around the holidays. Now, an arrhythmia is essentially an irregular heartbeat, and it happens when the electrical system that causes your heart to beat is not working properly. And of course, the most common symptom is heart palpitations. The heart's electrical system depends on several different ion channels working properly in order to conduct electrical signals throughout the heart, causing it to beat properly. Alcohol in the heart essentially functions as a poison. Specifically, alcohol will poison certain ion channels, namely certain calcium channels. Thus, alcohol can disrupt the normal electrical activity, leading to arrhythmias or chaotic heartbeat. It's also interesting to keep in mind that alcohol is a depressant or a sedative drug, and therefore withdrawal when you stop drinking has the opposite effect. So during a hangover or during alcohol withdrawal, your body responds by having an increased sympathetic outflow to sort of rev things up. This is the same nervous system that's responsible for your fight or flight response. This sympathetic outflow makes the heart more excitable and more prone to generating arrhythmias. And lastly, alcohol has a diuretic effect. In other words, it makes you go to the bathroom. This, of course, leads to a loss of electrolytes, or the normal ions that we have in our body. And given that our heart relies on ions and electrolytes in order to generate the signals that it uses to coordinate its beats, losing these electrolytes can stress the heart out and also leave it more prone to arrhythmias. In conclusion, alcohol and binge drinking can unmask or even precipitate arrhythmias in many patients. Consuming alcohol is, of course, a personal choice, and if you choose to do so, you should do so in a manner that's both legal and responsible. With that said, Happy New Year. I hope everyone has a great New Year's Eve, and I'll see you all in 2024.